Crisis looms in antibiotics as drug makers go bankrupt. At a time when germs are growing more resistant to common antibiotics, many companies that are developing new versions of the drugs are hemorrhaging money and going out of business, gravely undermining efforts to contain the spread of deadly, drug-resistant bacteria. Antibiotic startups like Achaogen and Aradigm have gone belly up in recent months. Pharmaceutical behemoths like Novartis and Allergan have abandoned the sector, and many of the remaining American antibiotic companies are teetering toward insolvency. One of the biggest developers of antibiotics, Melinta Therapeutics, recently warned regulators it was running out of cash. Experts say the grim financial outlook for the few companies still committed to antibiotic research is driving away investors and threatening to strangle the development of new life-saving drugs at a time when they are urgently needed. "This is a crisis that should alarm everyone," said Dr. Helen Boucher, an infectious disease specialist at Tufts Medical Center and a member of the Presidential Advisory Council on Combating Antibiotic-Resistant Bacteria. "The problem is straightforward. The companies that have invested billions to develop the drugs have not found a way to make money selling them. Most antibiotics are prescribed for just days or weeks, unlike medicines for chronic conditions like diabetes or rheumatoid arthritis that have been blockbusters, and many hospitals have been unwilling to pay high prices for the new therapies. Political gridlock in Congress has thwarted legislative efforts to address the problem. The challenges facing antibiotic makers come at a time when many of the drugs designed to vanquish infections are becoming ineffective against bacteria and fungi, as overuse of the decades-old drugs has spurred them to develop defenses against the medicines. Drug-resistant infections now kill 35,000 people in the United States each year and sicken 2.8 million, according to a report from the Centers for Disease Control and Prevention released last month. Without new therapies, the United Nations says the global death toll could soar to 10 million by 2050. The newest antibiotics have proved effective at tackling some of the most stubborn and deadly germs, including anthrax, bacterial pneumonia, E. coli and multi-drug-resistant skin infections. The experience of the biotech company Achaogen is a case in point. It spent 15 years and $1 billion to win Food and Drug Administration approval for Zemdry, a drug for hard-to-treat urinary tract infections. In July, the World Health Organization added Zemdry to its list of essential new medicines. By then, however, there was no one left at Achaogen to celebrate. This past spring, with its stock price hovering near zero and executives unable to raise the hundreds of millions of dollars needed to market the drug. For more on this story, visit the news article link.